Hello and welcome to the Bee's Knees podcast. This is your host, PJ Ewing. Okay, let's put ourselves in Kathie's situation. She had a knee replacement surgery with all the hope in the world that it was going to be a big turning point in her life, get her back to mobility and life that she had expected to be leading. And 4 months go by and everyone gives up on her. In this case, her insurance company, the physical therapy team, her surgeon, everyone's sort of throwing up their hands saying, we just don't have an answer. We don't know what to do. You're not bending your knee properly. It doesn't seem like we have a lot of other choices right now. Good luck. And in that case, in that situation, Kathie reached for her phone and her computer and started searching on Google for some answers. She ended up coming across the X10 therapy. She had a consultation in the office in Franklin, Michigan, sat on the machine, decided to go ahead with this as really a desperate effort to get her knee bending properly. And within 9 days, she had solved her problem.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
After 4.5 months of physical therapy, 9 days on the X10, and I got to 130 degrees. My name is Kathie. I'm 64 years old, and I had a total knee replacement right now about 5 months out from my surgery. I expected to be the Wonder Woman of recovery, and unfortunately, that turned out not to be the case in spite of my best efforts. I actually endured 38 outpatient physical therapy sessions. I would work as hard as I could and endure the pain to the point where I would literally cry, or it sounds gross, but sometimes I literally actually vomited just from the pain of, pulling on my leg. I gave it the best effort possible, but after a while it became really plain to me that what we were doing was not working. And in fact, my insurance company agreed and decided that it was not efficacious to continue outpatient physical therapy. I also knew that I was just literally going to have an emotional breakdown if I had to continue doing what I was doing. I said to myself, I sure hope my left leg holds out, because I am never going to do this again, because it was honestly the most awful experience of my life. And not because of the pain, because you expect the pain, but because of the debilitation, the loss of independence, and then in my case, when I got stuck, the lack of hope and the frustration. It's at that point that I decided I needed to look for something different. I came across a testimonial. Someone had done this thing called the X10. And then once I had that word, the X10 therapy, then a whole world came tumbling open to me of information. And I realized it was a real thing, and I realized that it was helping people. It ignited something in me which had been lacking for a long time, which was hope, that there was something that could help me. I was very comfortable. I actually felt like crying as I was sitting there on the machine, because I knew that the hope I felt when I first discovered the X10 website wasn't false hope. I knew that there was going to be a chance. One of the most important things is that the X10 comes with a whole team of professionals who are very much like family to you, and they monitor your progress, because the technology of this machine is so amazing that it sends your progress directly to them. It's hard to believe, if you haven't experienced it, that there could be such a difference in such a short time. 4.5 months of pain and suffering, and in 9 days, I feel like myself again.
The concept of X10 started with the idea that we could solve the single biggest problem in knee surgery recovery. That problem is variability. Too many people have disappointing recoveries that could have been avoided. There are too many varied approaches to recovery, many that unnecessarily push patients into pain. The design of the X10 knee machine started with the physiology of the human body and then added biofeedback mechanisms to feel the body's movement and make adjustments based upon that information. The other big idea was to put the control of the recovery process into the hands of the patient. No longer does your recovery depend on others. Rather, you are in control of the pace and quality of your recovery. The result of years of research and development is a small in-home device that you use for a few weeks before and after surgery that minimizes recovery times and rehab complications. You get the results that you want in your home within weeks of your surgery with the help of your own in-person and remote recovery team. There is some insurance coverage available, but most patients lease the X10 machine for about 3 weeks.
We'd like to thank a few friends of the Bee's Knees podcast, including the Knee Pain Guru, natural solutions for chronic knee pain without drugs, shots, surgery, or painful physical therapy. For more info, visit thekneepainguru.com. We are also brought to you by X10 Therapy. And a special thanks to Dr. Justin Trosclair at the podcast A Doctor's Perspective podcast.
I'm Dr. Justin Trosclair, host of 2-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
The Bee's Knees podcast comes to you from our studio in Lower Manhattan, New York City. We're here week in, week out, shedding light on all aspects of knee surgery and recovery. To reach us, send an email to thebeeskneespodcast@gmail.com.